will notice,
feel more uncomfortable.
More uncomfortable things.
So you can increase and reduce your speed according to patient's comfort.
When I treat the really important area, I slow down the movement speed, like this, very slow. More fluid should be can be delivered to the skin, but for the really not very important areas, I do the treatment quite fast, so I can adjust the treatment time according to the patient concerns and the degree of aging. Usually this degree of redness, erythema, is routine. It's downtime, so-called downtime of the treatment, and it goes away within 20 seconds or something.
Okay.
Some doctors are using it on the upper eyelid skin, but really be very careful not to cover the eyeball itself. So it's better to pull the skin tightly. So the upper eyelid should be positioned over the orbital rim, skull. And in this case, it's really so you see the fluids overflowing. So in this case, I change the tip.
Oh, why is the reason for an overflowing? It's blocked. That's it. One face needs how many tips?
It depends. Sometimes I can use only one tip for the full face treatment, but if the patient has a lot of scales or oily component, in that case the tip, very small hole in the tip is plugged by the debris, skin debris. So in this case, I change the tip. Perioral area is a great area to treat using this device.
You're going over a couple again in the same areas. You repeat the areas.
Because there is no actually end point of the treatment, so in my practice I do 3 or 4 passes for the really important area, but I just do 1 or 2 passes for the rest of the area.
And you do half face first before you do the other half?
Yeah. So that's all. I need to
So do you put any extra solutions into the bottle or into the, if you want to do, when you give other micronutrients or do a peel?
No, not peeling agent, but nutrients.
Okay.
Or vitamins.
Okay.
But we have to always take the cost-effectiveness of the solution before the procedure.
So you put it into the bottle, or you?
Yeah, into the bottle. Yes.
Do you normally do that, or you mostly do this only?
For the extra patient. Using a standard solution is my routine.
Okay. So basically, it is it deep cleanses the skin, right? And then what else does it do? What are the good effects? Is it?
Well, because as you know, weak alpha hydroxy acid is a well-known solution for new collagen generation, as you see, which is a well-established concept in terms of the very light chemical peels. So basically, this treatment is related with so-called light chemical peels inside the skin, not the surface, but intradermal.
Because it cleanses and delivers, isn't it? So you get it. Okay.
Yep. And secondly, the solution is basically a carbonic acid solution, which is a solution of a carbon dioxide gas.
Okay.
It's actually soda, like a soda water.
Okay. Yes.
So carbonic acid inside the skin give rise to the the lowering of the local tissue pH.
Okay.
And that lowering of the pH will shift the so-called hemoglobin oxygen dissociation curve, which we've learned long time ago during our physiology lessons. And the right shift of the curve is related with the detachment of the oxygen molecule from the hemoglobin locally. So that will increase the tissue oxygenation, of course, and secondly, that will lead to the local tissue acidosis. And tissue local acidosis is related with is regarded as a very potent angiogenetic factor. So it will increase the local blood flow and neoangiogenesis, and after that that will trigger the formation of a new type 1 collagens, which is the main aim for the general skin rejuvenation.
Okay.
And if you use different solutions, for example,